Welcome to Healthcare by the Numbers, a podcast that uncovers what's driving healthcare transformation. Join us each episode as Caravan Health leaders interview the brightest minds inspiring healthcare innovation and discuss the numbers which have shaped their thinking.
Welcome, everyone. I'm your host, Louise Yinug, Senior Policy Analyst at Caravan Health, and this is Healthcare by the Numbers, a podcast that explores the numbers driving change throughout our industry. To learn more about Caravan Health, this podcast, and to check out episodes of the show, visit caravanhealth.com. And be sure to sign up for our newsletter to be notified of future episodes. You can also visit our program page on Healthcare Now Radio and follow us on Twitter, LinkedIn, and Facebook under our username @Caravan Health. Today, I'm pleased to be talking with two of our Caravan Health leaders, Jade Jagers and Rusty Schlessman. Both are regional vice presidents. Jade and Rusty will share their approach to ACOs, lessons learned from working closely with clients, and what we can expect to see in the future for our clients across the country. Welcome, Jade and Rusty.
Good morning. Thank you for having us.
We're so glad you're here. So at Caravan Health, we guide our partners in their journey transitioning to value-based care. Jade and Rusty have helped shape the largest ACO in the country and have been a key part of this effort by working alongside with clients as trusted advisors, identifying improvement opportunities, and sharing pertinent information. Jade and Rusty, can you each share your background and what you do here at Caravan Health?
Yeah, I'll take a stab first, Rusty, but a little bit of background for me was actually before I came to Caravan, I worked more in a nonprofit grant space, really focusing on health prevention and other ACA and CMMI affiliated grants. So my job back then was really similar in that we were working with stakeholders, coalitions to help assign, align, and really build communities. So graduated from Montana State University here in Billings, Montana. I still call that here home today. And since then, I've been at Caravan now for the last 6 years, and I've always really worked on the delivery side, getting to work directly, really hand in hand with our clients, mostly with those who are in the Mountain West region. And that ability to serve rural and frontier is really the best and my favorite parts of this job.
Thanks, Jade. How about you, Rusty?
Yeah, no, so as Louise said, my name is Rusty Schlessman. I've been in healthcare for about 17 years, and it's been split almost evenly. Started my career out on the provider side, working in various hospitals and health systems, really in the finance and operations roles, before moving over to healthcare consulting. Started there really around revenue cycle and performance improvement. And then I've been at Caravan for about the last 3 years now. All the RVPs, the RVP role, I should say, started 3 years ago for everybody. So we'll talk a little bit more about that as we get into it. But that's my background in a nutshell. So appreciate the ask.
Well, we're so glad to have you both. So our show, of course, is called Healthcare by the Numbers, and we like to sort of introduce our guests and spotlight and frame the conversation with some of the numbers impacting our industry today. In 2020, there were more than 500 Medicare Shared Savings Program ACOs that covered 11.2 million patients. And in 2020, those ACOs earned nearly $2.3 billion in shared savings, while saving a net $1.9 billion for Medicare. So really impressive results. CMS recently announced a goal of getting all traditional Medicare lives into accountable care or another total cost of care arrangement by 2030. So just by the end of the decade in fewer than 10 years. Caravan Health runs the largest ACO in the country with more than 200,000 attributed lives and includes providers in more than 31 states. 100% of the providers in our collaborative ACOs earned shared savings in 2020. And those shared savings for Caravan ACOs increased from $50 million in 2019 to $68 million in 2020. So those are the numbers. Jade and Rusty, you're doing that hands-on work of improving healthcare and implementing population health initiatives every day. What numbers are you most proud of?
There are a lot of good numbers. It was hard to pick just one, but I will say the number that is on top of my mind right now is 2022. Maybe that's corny, but I'm looking ahead and really excited to what the next calendar year will bring. Not only for Caravan Health as a company, but our clients as well. So Rusty, what's your favorite number?
Yeah, and Louise definitely shared a lot of great numbers there. And the ones that stick out to me aren't necessarily on there, but it's really kind of the success our large collaborative ACO has had over the last two program years. So 2019 and 2020, total of about 56 million in shared savings returned back to those clients. That always just puts a smile on my face. And I know it definitely puts a smile on our clients' face when we're able to get those distribution of funds back to them. So I would say those are some of the numbers that I think stand out for me, especially during the times that we've gone through over the last 2 years. A lot of challenges with volume, with patients, especially with COVID, and kind of what the bottom line is going to look like for these organizations. So being able to write them a check or at least distribute those funds out to them has been especially rewarding for me.
Number 19, it's COVID-19 in despite of.
Exactly.
Maybe that's the number to focus on.
I like the way you put that. So as you mentioned, this sort of group of regional vice presidents started 3 years ago, and you were both part of that group as we launched our new, more regional approach to delivery. I'm wondering how each of you would describe the typical Caravan Health client.
Well, I know I'm going to go first on these, Rusty, so I'll take another stab on this question. It's a hard one, but yeah, I think when you think of words to describe a client, I struggle with that because there isn't a one size. There's not even a facility type or a lot of those other tangible characteristics, like how many providers they might have. But if I had to apply some traits, some personality traits, I think a typical client that I work with, they are curious, they're tenacious, and they have a sense of leadership and innovation. And I say that because this is still a voluntary program. People are agreeing to sign up to participate in this. And so it really does take somebody with that visionary leadership, I guess, to agree to do this really difficult, heavy work in the first place. So I think the clients that come to work with us at Caravan have that natural desire to learn and understand and apply the concepts that we teach or consult to them so that they can keep providing really good care to their patients.
And I would agree with Jade. It's really hard to describe what a typical client is. It's almost asking a consultant what's a typical consulting engagement timeline look like. You almost can't answer it because it really depends on the client. At Caravan, we work with RHCs all the way to large academic settings and everything in between. And I think that's one of the things that really sets us apart from other folks in the industry is our ability to work with providers at all levels. They all have different challenges, but they also sometimes have common challenges and common themes that they work towards. So we are able to connect those folks together, whether it's an academic setting with a critical access hospital that may have the same challenge, and maybe one's figured it out and they want to share that with others. And because we get to work with everybody in all those different setting types, we're able to connect those two clients together while sharing some best practices along the way. So I would kind of, and then echo a lot of what Jade had said as well, just kind of, it's hard work. How do you get through it? And I think bringing folks together as a team really helps with that.
I'm curious about, so in today's market, there are a lot of value-based contracting options. And I'm sure when you meet with a Caravan Health's clients or practices that might be thinking about getting into an ACO, there are questions about what exactly the benefits are of ACO specifically. I'm curious how you explain those benefits to clients or prospective clients.
I think the many different types of benefits that are out there, there's usually, I don't know, the one that speaks to a client might be different, kind of going back to the uniqueness of each of the communities that ultimately choose to move forward with us. But what I like to share is, an ACO is really a mechanism where you're telling CMS like, hey, I officially accept responsibility for these patients. And then when you give that green light, you are given some additional tools, I guess, to help you take care of your patients and do that work. So from my perspective, I think one of the biggest advantages or benefit is the fact that you get the data to help you answer those questions in the first place about who and what your patient population is doing. So we can help them answer or solve problems like, who should I reach out to for a preventative service? Or who could use some extra support for via a care management situation. So I know the financial opportunities are there too, but I think the biggest benefit is just being able to, once again, take better care of your patients because you're able to better deploy your resources and use your time.
Yeah, and I'll take a step back and kind of if we were talking to a prospective client, kind of what are the benefits from that perspective as opposed to a current client? Prospective clients have a lot of questions when it comes to ACO work. Some of them have participated, some of them haven't participated. I personally think the benefits of an ACO and the participation in that are pretty straightforward, really tied to the triple aim, lower cost, improved care, and improved quality all around. And that's really the main driving forces between or what an ACO is supposed to do. If providers can demonstrate that they reach those three aims to CMS, there are financial incentives. You also improve your care and quality. And CMS has put those kind of levers in place to achieve shared savings, so that there is some opportunity there from an incentive perspective, as well as some incremental revenue as you think about just population health activities, similar to what Jade was mentioning, like annual wellness visits and chronic care management. Some of the additional downstream revenues like diagnostics, labs, bone densities, colonoscopies, those types of things can also help support organizations if they're not capturing those. Participation in ACO, just how do you do the work today? I mean, that's kind of getting down to it. So the hard part's not the benefit piece of it. I think the hard part is really explaining it and how do you actually stand up the ACO work? How do you set up your organization to be successful to do this work? And that could be either, and it's very complementary as we think about MA programs and commercial plans that are also offering ACOs. So sometimes they have very similar quality metrics or care plans that need to be done or wellness visits. So it's very complementary work across the board. And I think those things tied together kind of help organizations make the decision to move into the ACO work.
I'm curious to hear a bit more about the large collaborative ACO. I think you've both mentioned sort of the really outstanding results that large ACO with more than 200,000 lives has been able to achieve. So this includes providers across the country of all sizes and types. How is it possible to create an environment of mutual accountability with such a large and diverse organization?
Accountability is a big part of what our clients need and really do trust Caravan to handle, right? And so we can do that through, we've got a few like mechanisms that are set up for that, including we've got a dashboard and some other kind of, I guess, tools. But my favorite is just, the engagement part. Showing up, I really feel like is half the battle for some of our clients. And when you have somebody that's engaged, using the tools that we've created, attending our webinars and wanting to learn, we just had a quality push here recently. And showing up for our calls in general, I really do believe then that the results follow. They're engaged and they're here for it, right? So we also set up and meet client-specific goals. And that is one of the most rewarding parts of the job as well, too, kind of chasing that feeling of finding success locally and that win. And that's a lot of how we then translate, the small wins at the local level translate to the bigger success of the ACO. What do you think, Rusty?
Yeah, no, I definitely agree with the engagement piece of it. I think we see that clients that are more engaged are more successful in doing the work. And one of the things I would say is, if you take a step back and think about an ACO as a clinically integrated network, which is what it is, and put that mindset to work, where there's, as Louise mentioned, over 100 different providers have come together to participate in this contract with CMS. For the Medicare patient population. It's similar to if they were to go out and negotiate an agreement with Aetna, Blue Cross Blue Shield, any Medicare Advantage plan for a specific value-based care arrangement. The only difference mainly is that you can't negotiate with CMS on this contract, whereas those others, you probably have some negotiation room. So if you think about how they're coming together to participate, they want to be successful. They want to see the fruits of their labor be rewarded. And typically that is financially, but it also is better patient care overall. And so I think part of that is back to Jade's comment on accountability kind of equals engagement. And it is true. I mean, if the providers aren't engaged in doing the work, they're probably not going to be successful. If they're not successful in the Medicare shared savings contract, if you will, they're probably not going to be successful in the Aetna, the Blue Cross Blue Shield, you name the payer who has an ACO program. they probably won't be successful in that either. So I think just changing the mindset and getting everybody on the same page of, we're all in this together. To be successful, we all have to row in the same direction, if you will. And so that's what Caravan's really main role is, if you will, of getting all the clients engaged to do the work, sharing information with them, setting goals, and then also making sure that everybody is accountable so no one falters. So that's what I would say.
It's just interesting to hear the sort of wide variety of clients that you both work with. I'm curious if there are specific things that your clients are looking to get out of participating in an ACO, or if there are common themes when you talk to a client about, or talk to a variety of clients about what they're looking to get out of the participation.
Yeah, I think a lot of the clients that I take care of in the Mountain West region and are truly rural or frontier based, the whole reason they ever came to Caravan Health in the first place was under that AIM umbrella, right? And I think that I don't know, a theme of wanting to learn and put some of the basics together in a, the numbers work right now. Now we're in a safer, a safe environment with having the scale, but I feel like my folks are continuing to participate even after AIM ran out because they believe in the programs that we're doing and that they can be applied across their entire population and help them not only be successful in the MSSP portion, but like Rusty said, any value-based contract that might come down the chute. And so I feel like Caravan gives them a safer place to practice, hear from experts, and make it make sense within their own facility. So they believe that the transition from volume to value is going to happen. It's not a conspiracy theory. So I think they're wanting to stay ahead of the curve and be in that position to find success. So they want to be a part of the innovation. They want to have a seat at the table and have that conversation about taking care of their folks.
Yeah, and I failed to mention, so I have the Southeast, so Jade and I couldn't be any further apart geographically, and have a little bit probably different mix of clients than she does. I don't have the frontier space. I do have several rural-based clients, but I also have a mix of larger clients. And so I posed the question to a couple of clients, what were you looking to get out of participation in the ACO with Caravan? And the common theme that came back was, we'd really like to achieve shared savings. And we always try to be realistic with clients. You may not achieve shared savings in that first year, although some of them have, and it's been great. It's a great success story to share that with them. And the other pieces, they want to continue to deliver great quality to that patient population. Most of the clients said they were doing the work already, which is not a surprise. So they're capturing quality, they're closing care gaps, maybe not as well on the Medicare population, maybe some of those MA patients or Medicare Advantage patients, but they knew what the work entailed, and they were focused on quality, and they were focused on HCC capture just to due to some of their other payer contracts. And so for participation, how do we get the shared savings? You have to do the work, right? And as part of that, participation does take a lot of work, is what we've been talking about a little bit. And that's why really they've partnered with Caravan. They wanted some of the analytics components. They wanted that practice transformation piece. They wanted our clinical expertise to come to the table. And so that's why a lot of the clients have partnered with us to move forward in their value-based care journey.
All right, thank you. I want to get back to what Jade had said about looking forward to 2022 as their sort of next most exciting number. So what can our ACOs look forward to in working with Caravan Health next year in 2022?
I mean, I don't want to overpromise, but a lot, I think. There's a lot of cool stuff, I think, happening. And that's because our clients just continue to get smarter, savvier, and are searching for the next big thing. And so Caravan ultimately needs to become better, faster, and stronger just to keep up. And I love that. And so I know that I'm really looking forward to some of our new tools that we'll have, some new analytics, more improvements around our technology platform coach, and the ability to use that data to hopefully make our population health nurses' lives a little bit easier. And maybe this is a pipe dream, but I am excited to hopefully reconnect in person with some of our clients because of COVID. I haven't seen a lot of these folks in like 2 years. So I'm hopefully excited to see some faces in person. And so, I think Caravan is continuing to push boundaries and out on the fringe sometimes. And I love that. And I think our clients can continue to expect Caravan to help lead and assist in this next kind of leg of our journey. What do you think?
Yeah, no, and I'd love to get back out on the road and visit clients in person. I think that's something that's definitely on the list to do. I think one of the great things about working with Caravan is that we always take the guesswork out of what's to come next, whether that's a new CMS program, and how do we go about delivering what's to come and what's next, and kind of helping prioritize for our clients. And I'll give a couple of examples here. So in 2019, actually probably in 2018, the organization really decided to develop a new delivery model. And part of that redesign occurred at the start of 2019, where they hired 10 regional vice presidents and really split the country out into a different model, really kind of wrapping around services around that regional team. And it was really to help better support our clients to be successful. In 2022, we're doing something very similar again. We're going to be adding regional managers to those regional teams to further support our clients. I'll say when COVID kind of reared its ugly little head, one of the things that Caravan did was we pivoted. We completely shifted our model, went virtual, everything, just like a lot of other folks did. But we also developed a whole new series of information around what does virtual care look like for our clients. And we had webinars and best practices around that to really help support our clients during those difficult times. And so to Jade's point, we pivot very quickly. We kind of see what the market needs and what our clients need to be successful. We pivot in that direction and make sure that we have the resources, training, and education, and the staff team members to help support them.
That's all very exciting stuff to look forward to. I know maybe as podcast host, I have a little bit of inside information about some new programming that's coming in 2022 that our clients will be able to participate in, just related to sort of strengthening the safety net, supporting physicians and nurses in a kind of a new and more hands-on way. And you'll be hearing more about it on the podcast. And we're really excited for some partnerships that are coming up. So Jade and Rusty, it's been a real pleasure having you here on Healthcare by the Numbers. Do you have any final thoughts or comments you want to leave our audience with?
I was telling Rusty, I'm going to check this being on the Caravan podcast officially off my bucket list. So thank you guys for having us.
Yeah, no, we appreciate all the listeners and Louise, yourself as well, for hosting us. Feel free and have us back anytime. Happy to share our experience and what we're hearing out there as we work with clients.
All right. Well, I may hold you to that. Thank you very much. We're always looking forward to hearing from people who have the sort of hands-on experience with working with our clients. It's nice to hear that perspective up close. Well, thank you very much for joining us today. For our audience, if you'd like to learn more about Jade and Rusty and the work they're doing at Caravan, you can find them both on LinkedIn at Jade Jagers and Rusty Schlessman. That's where you can find them on LinkedIn, and you can find more information about Caravan at www.caravanhealth.com. I want to thank everyone for listening. We are Caravan Health, and this has been Healthcare by the Numbers. Until next time, take care.